You ever binge watch some ingrown toenail video on TikTok? Once you watch one and you like it, they just keep coming.
Yeah, I know. We've done it multiple times. Yeah. And we're reacting on some viral ingrown toenail videos and giving you our expert opinion. I'm Dr. Richard.
And I'm Dr. Blanchette. We're both board-certified podiatrists and foot and ankle surgeons.
This video is not about shaming anyone. We just want to educate. Also make sure there's no misinformation online.
We see ingrown nails all the time, and then we just want to give our professional advice while looking at a video. So we'll see how that looks like.
Yes.
Wait, you're gonna get these removed?
Yeah, they told me that they would cut a flap, cut the nail down to the bone, and then cauterize it.
Why? Is it bothering you? Is it because you say you wanted to cut the corners?
Well, yeah, I didn't want the corners to hurt anymore, so that was the resolution that they provided.
You know what? Let me tell you this. Don't go see a podiatrist and remove your ingrown toenail if it's not bothering you to the point where you're starting to see infections or pus coming out.
No.
What?
No.
You don't have to have pus coming out of your toenail in order to have a procedure. She clearly said that she's tired of having pain in the corner.
It's a chronic condition. It's recurrent. It's definitely indicated to have a permanent partial nail avulsion when that happens.
Exactly.
A lot of time when they remove the ingrown toenail, your toenail would not look the same anymore. They would literally just cut a piece of your nail out, and going forward, your natural nail is gonna grow weird, and you're gonna have a gap right here. A lot of time removing an ingrown toenail out, the doctors, they just remove it. They don't care how it looks at the end.
That's not true.
No!
That's
I
not
make
true.
sure that it's very aesthetically pleasing.
Same.
Yeah.
Because, and also like the piece of the nail that we remove is inside the skin.
Exactly.
So usually, oftentimes, like after the procedure, the nail's gonna look very much the same as it used to be before, because what we're removing is everything that's like dug inside the skin.
What you don't really see. So we only need to remove what's needed. When I do the permanent, I don't go aggressively.
Exactly.
I just remove what's needed, and it can look very aesthetically pleasing afterwards.
I mean, I'll show you my toe later. I had one done on my toenail. My toenail looks normal.
Super
and
cute.
then it's not gonna give a gap because the skin is gonna grow on the inside the gap. Like, you know, like it's gonna grow.
It depends who does it.
Exactly.
Let's put it this way.
It's true. It's true. Because
vet your doctor first.
come and see us.
Polish on and maintain your toenail, just go get a pedicure. All we do is we cut the corner and we file them so that it prevents the nail from pinching down to your skin, and that's all you need.
And then when it grows back, you're gonna come and see them again and again.
Yeah, and the risk with that is that, especially, let's say, you never ask, is the patient diabetic? Like, if she gets an infection, that can go south really, really quickly.
When you go to a podiatrist's office, the instruments are sterile. You know, when you go to the pedicurist, I'm sure there's some of them out there that have very good, proper, clean techniques, but not all the time. And then you can have fungus and things like that. So the more you go to get the pedicure, sometimes it can lead to other issues.
Even if they take out the instruments from, you know, those blue bag, it doesn't mean it went through the full sterilization process.
Yeah, and then, I don't know if you know, but one of the only safe way to remove a spore, which is from fungus. This is how fungus propagates. I describe it to my patient as like almost like a nut. So there's like this outer shell that's very, very resistant to everything. And what's gonna kill it is to go into an autoclave. Basically, it's like a little cooker
A machine
for instruments that we have in the office that goes to a very high pressure, very high temperature. And then this is how we sterilize the instrument. This is what is used
for surgery.
Exactly, in the
operating room.
Exactly. So.
Only time I recommend a podiatrist is if you have an infection or something that we cannot do to maintain your toe, then you see a podiatrist. But looking at your toes right now, these are beautiful toes. So I don't recommend you seeing a podiatrist to remove anything. If it's bothering, just let me know. I can cut the corner and go from there.
Make things worse.
That's great. Thank you.
Yeah.
Well, there's a risk.
Like, for example, you see how I'm
doing those repetitive cuts.
Exactly. So I don't agree with that.
Me neither. What?
This, I'm like, don't do that.
That's so aggressive.
I hate when they cut
The
all
cuticle.
of the cuticles.
It's there for a reason. Yeah.
Yes. It's to prevent, I know, it's
Ouch.
to prevent the bacteria, fungus, whatever, to go inside of your nail at the base. This is,
Where's she got all this fucking skin from?
oh my God. It's so aggressive. This is insane.
Too aggressive.
Don't
Yeah.
do that, please.
Yeah, so basically, anatomically, you have the cuticle and the hyponychium. You also have some skin underneath the nail plate, and it's there for a reason. It's there to protect from bacteria,
Yeah.
fungus infection to come in. So never be this aggressive. You want to leave some there to protect your nail.
It's almost like a little silicone seal that we have, like, you know, in the shower, in the bathroom, around the sink to prevent water to go in. Well, it's to prevent bacteria and fungus to go inside of your nail. If you don't like the appearance of your cuticles, there's other things that you can do. You can use some moisturizing oil, or you can use some cream just to moisturize your cuticle. It's going to be helpful. You can push them a tiny little bit, but don't go ahead and cut them this way. This is not no-go.
Too aggressive.
Yes.
Oh, yummy.
It hurts right here?
Yeah, because again, ingrown.
Yeah,
Ingrowns.
definitely from an ingrown.
It's just skin.
Okay, little speech time.
It is so crazy the amount of clients I have got coming in with the same problem. These shops are cutting the corners of the nails, and your body is producing dead skin to fill in the gap where they're cutting the corners.
No. That's not, no. This is not how callus works. Callus works, it's there for a reason. It's there for a point of pressure. If you cut something, it's not going to grow more skin to fill in the gap. This is just not how basic anatomy works.
No.
And
No, she definitely have very curved toenail.
Exactly.
And you know, it digs in, and then the skin, to protect itself after pressure and friction, it builds more callus. So it's likely an ingrown toenail.
It is an ingrown nail. So the nail is not, you know, inside of the skin like completely, but this is a type of ingrown nail. Basically, there's just so much skin
This is
around
also
the
making
side
your
there.
nails more coffin shaped.
Quick pause. If you find this video helpful, please consider subscribing and also liking this video. It really helps our channel grow to reach more people that have the same problem as you. Okay, let's get back into it.
5 things.
Oh, this does.
Yeah.
That looks painful. You can see that this is not
They
the first
did.
time that
They
it's been,
did,
yeah.
Oh
Looks
no.
like it's a chronic issue.
Poor patient. Like that's gonna help.
I know. This looks, I don't know if it's like...
Let's
just
see
look
how
at the-
deep they go.
I know.
No. Oh, did you hear the patient screaming? This is barbaric.
Oh. It's bleeding.
Poor patient.
It's so sad, but you know what? I was reading, so this looks like it was like in maybe Thailand or something like this. But they don't really have podiatrists there, unfortunately.
see.
So like people, like they kind of have to rely on things like this, and having this done
Ouch.
under like no anesthesia.
No anesthesia. I feel really sad for the
I
patient.
know.
Like they shouldn't suffer and go through this procedure just with cold spray. Cold
know.
spray, it doesn't numb your toe.
It doesn't cut it.
Yeah, it just feels cold superficially. One thing I do like about the video is that they are using some gloves, but we don't know if the instruments were sterile or if they properly did, you know, aseptic
Disinfect the-
measure, like
yeah,
if they
the-
use like
the skin.
betadine or clean the skin before. I had a patient with that before.
And then it looks like it's the same account as earlier. So unfortunately, it looked like they don't have, you know, access to podiatric care. Unfortunately,
Oh, that's gonna be painful.
it looks so painful. I feel so bad for those patients. Like unfortunately, like this is gonna help a lot, but it's gonna come back. You know, they
Yeah.
don't do anything at the root of the toenail, so it's gonna grow back.
Exactly. So Oh my goodness. Yeah. That's gonna help to remove that.
Huge press. Oh my god.
This was left behind, definitely.
Yeah, so
Good
everything,
that it's out.
Yeah.
But yeah, what you're seeing there, that extra skin, it's a pyogenic granuloma. So that's usually with more severe type of ingrown. The skin protects itself by building more skin that bleeds really easily. But, you know, this one is pretty big.
It's
so
massive.
it is considered, like, if I see that in the office, I usually do remove it and send it for biopsy as well, just to make sure nothing else is going on.
Yeah, because sometimes you can have skin cancer, even some melanoma, like amelanotic melanoma, which don't have the pigmentation that melanomas have usually, and that can mimic an ingrown toenail. So it's really good to send it to the lab.
Yeah, and to treat the pyogenic granuloma, if it's a benign, if it's not cancer, how we treat it, usually we do need to remove the piece of nail that is the problem, that is causing the irritation, which was removed there. But usually I also use something to stop the
Cauterize.
growth. Yeah, so either silver nitrate to cauterize that, or I remove it surgically to remove that extra skin growth as well.
Ingrown toenails without any cutting or pain. Instead of digging the nail out, it gently lifts the edges away from your skin, instantly relieving pressure. A tiny grooved plastic strip that
No, not that. The tape, sure.
The tape I'm okay with,
but
no
this,
blood, no pain,
No.
just pure design genius
Let's
at
just-
work. This little tape is designed to fit.
No.
let's just put a foreign body inside of your nail, right between the nail and the skin, like that. No, it's gonna increase the pressure and then hurt.
Yeah, and push all the bacteria in. Come on. Don't do that. Yeah, you have more risk of developing infection. You know, taping sometimes I do recommend, but don't put something underneath that nail plate.
I actually like their technique of taping also.
Yeah.
So go underneath the nail like this. I like that, but otherwise, no.
ไม่ขยับมีดนะตัวเองมีดนะ
Oh no, she's screaming.
Oh, this is
Can I hug this patient? I feel bad.
No, I feel so bad. Oh my god. It's gonna hurt so much. I feel so bad. It looks again like, see, like the writing on the bottom, it looks like it's still like probably in Thailand or something like that. I feel so bad for them.
It's almost done. But yeah.
And then, you know, like to use like cotton balls, like you can have like little pieces left there.
Exact.
แง่มองได้ขนาดนี้
I mean,
And it
you
looks
know,
like it's not coming out. So you really need, usually when you do a partial nail avulsion like this, I prefer to use like a spatula, right? To free up all the soft tissue. So
once
like,
the patient is numb.
yeah, once the patient is numb, that's the main thing, and you use a spatula to remove the soft tissue.
Yeah.
So like that, you're sure that you're gonna get the whole nail plate, not like a little spicule is gonna stay behind because it's still
Exactly.
attached to the
Yeah.
soft tissue.
Yeah. Oh, I'm like in
I know.
pain for the patient. I feel so bad. But you know what? Like I said, like it looks like they don't have access to podiatric care. I mean, it's good that somebody is doing something because clearly there's a need for it. The person that's doing it is actually good in a sense that she doesn't seem to be scared of the screams.
Yeah.
I know, like if my patients scream in pain, I'm just like, I freeze. I'm gonna wait. I'm gonna put medication and
Yes,
stuff.
I'm gonna wait,
I
make sure they
know.
feel nothing. Yeah,
I know, but like they're just screaming for,
I know.
for them.
Oh.
ask you how did you hear about us okay
That looks like. So this can be either
Fungus, psoriasis.
or also, so somebody stepped on the, or like a subungual
Hematoma that has been growing back.
Okay.
So
Nanoflex. Oh, this looks like Cariflex.
Yeah.
They're gonna rebuild the nail basically.
After.
Oh, this looks good.
Yeah, this looks actually pretty good. But we don't know if it was done,
Like
with
with
sterile
the-
instrument,
no,
So if you put this and it was not done with sterile instrument, then you inoculate fungus and...
Exactly.
Yeah, especially if it was from trauma.
Yeah. And then, like if I had seen patients like this in my office, I'm sure you would have done the same. I would have sent the clippings to the lab because I want to know what's underneath there. Is it a fungus? Is it bacteria? What's going on underneath
Or
it?
is this just trauma? By doing a nail biopsy, we'll have the proper diagnosis.
Yeah, and then, like in the pedicure, you can't do that, because they're not medical professionals, so they can't send things to the lab.
Yeah, better to know what's going on before you put an occlusive layer on top of it.
Exactly.
Then it looks good at first, but can be worse more long term.
Lifting the nail. They're using acrylic to lift up the nail. I mean, acrylic is not the best on the nails to begin with.
Yeah.
I like the I like the technique, meaning
It's not
that
the worst,
it's not
but-
the worst thing. But then there's other things that can be done. So this is kind of like almost similar to using Onychomycosis or like a toenail bracing, basically, but just using it with acrylic instead.
Yeah. Acrylic has more like chemical products. The ones that we use are either from dental resin and it's all like medical grade type products. So definitely I would do something more the Onychomycosis, or if it's for like aesthetic.
Yeah,
I
with the
would do more.
podiatrist. Yeah, because there's a lot of like conservative ways to deal with ingrown toenails. And then, you can look actually at a previous video that we just did that was going through all of the conservative treatment that we can do for ingrown toenails, including bracing. So it's similar to this, but just with, sterile instruments and as well as medical grade materials.
That's a wrap. That was definitely entertaining.
I know. Yeah, we saw a lot of different techniques, and then we shared with you what to do and what not to do. Which there was a lot of. And if you ever see any of those type of video online, we are on all of the social media. So please tag us at StepSistersDPM, and then we can react with you.
If you want more information about ingrown toenails, we have a playlist where we go in depth about what's an ingrown, what are the at-home remedies, what conservative treatment can be done in the office. So don't miss this out.
Until next time, bye.
Ciao.